Alright, so now I'll be demonstrating how to administer an intramuscular injection. So as always, we're going to start by checking the order for the right dosage, right medication, right patient, route, time, expiration date, all the basic rights of a medication. For intramuscular injections, you will use a 3 milliliter syringe. The needle length will be between 1 and 3 inches, and the needle gauge will be between 20 and 25. So I've got my 3 milliliter syringe and my needle. Before I do anything, I'm going to make sure I assess for allergies. I ask the patient if he has any allergies before I give the medication. I'll make sure to provide privacy. And then I'm going to put on my clean gloves because this is not a sterile procedure. Alright, and before you give an IM injection, you're going to make sure you select the appropriate site for the injection. There are different sites that you can use for an intramuscular injection, like the deltoid, the vastus lateralis, the dorsogluteal, the ventrogluteal, and rectus femoris, which I will be showing you how to locate at a different time. You will confirm once again. You're going to make sure you confirm your order, which is 2 milliliters of medication. So once you've got your medication and you've compared it to the order, you will prepare the medication by making sure you clean the top very well. You're going to let it dry. Normally you'd have a blunt needle to draw the medication, and then you'd replace the needle when it comes time to inject into the patient. But I don't think I have the necessary supplies for that. So now that that has dried, I'm going to remove my cap. I'm going to draw up 2 milliliters of air into my syringe. Got 2 milliliters of air. Now I'm going to inject it into the vial. I'm going to pull back 2 milliliters of medication, making sure there are no bubbles. If there are bubbles, I'm going to thump it. If there's a bubble in your medication, that just means there's no medicine there, which alters your correct dosage. All right. I've got my 2 milliliters of medicine. I'm going to recap. Now that I have determined my correct site, I will administer the injection using the Z-track method. So when you perform the Z-track method, you're going to pull the skin about 1.5 inches to one side with your non-dominant hand. And once you pull it, you're going to take your swab and clean it, making sure it's clean. You're going to go from the center, rotating outward. You're going to make sure you do not move this hand. So now I'm going to remove my needle guard. Alright, I'm holding my syringe between my thumb and the forefingers of my dominant hand. When you insert a needle IM, you're going to go at a 90-degree angle. So I'm going to insert at a 90-degree angle using the dart method. And in a normal instance, it would go all the way in, but it's not in this one. So you're going to anchor it with this hand, making sure that you do not let go of the skin. So now that it's anchored, I'm going to inject the medication. You're going to hold it there for an additional 10 seconds. And when you get ready to remove your needle, you're going to remove the needle and the skin simultaneously. You would take this, dispose of it into the sharps container, and that is how you perform an IM injection. Alright, so now I'll be demonstrating where to administer intramuscular injections. There are 5 sites that we can administer an injection. We've got the deltoid here. You take your hand and measure about 2 to 3 finger widths from the acromion process, and you can draw like an imaginary triangle with the tip of the triangle stopping at the axillary line, and then go right there in the center and find the meaty part of the arm right there, and that's where you would give the deltoid injection. Alright, and then we'll have the vastus lateralis, and when you're trying to find that site, you're going to place one hand breadth below the greater trochanter and one above the knee. You're going to have an imaginary anterior line and lateral line. Then you're going to go about 1/3 of the way over, which is right here. And when you give these, you want to make sure you pull the skin up and get it off of the bone. In the deltoid, you'll have less than 1 milliliter of injection. This site, you can have no more than 2 milliliters of medication. Then you've got the rectus femoris. You place your hands in the same position. Instead, you go toward the middle, the anterior line right here. And this is where you will give your rectus femoris injection, which is no more than 2 milliliters of medication. I'm going to get you to roll for me. Alright, then we've got the ventrogluteal. When you do the ventrogluteal, you want to take your hand and place it right here on the trochanter. You're going to point one finger towards the superior iliac spine, and then you're going to extend the rest of your fingers, creating a V. And right there where the V is where you will give the injection. And for this site, you can have no more than 3 milliliters. This is the most recommended site for injections. And then you've got the dorsogluteal, where you'll go right above, you'll find the iliac spine here, and you'll come over to the greater trochanter, and it's like an invisible line, and you'll come right above it, about right here. So about right here is where you will give the dorsogluteal injection. This is not a recommended injection site because it has many different problems, but if you have no other option, this is where you can give it. I'm done. I'm gonna have to crop this last part out.